Hello, hello. Welcome back. Welcome back, wonderful technologists. Hope you guys are having a awesome week. It has been crazy for me as far as business-wise, work-wise, kid-wise, everything. Because one of my daughters, who, if you heard in the last episode, I have special needs children. She requires a lot of doctor's appointments in the middle of the summer. It's something that is just a phenomenon and it just happens all the time. So that is what I've been up to. So, little housekeeping before we get into today's episode. First off, I am hosting a 3-day live challenge on how to improve and elevate your skills to be the go to CT tech. It is going to be amazing. We're going to have lots of fun. So I am hosting this live event on July 31st, August 1st, and August 2nd. So make sure you check out the show notes so you can sign up for the challenge. Actually, the event, live event. And we're going to have some fun. And I'm going to teach you some shit in CT. So we're going to make sure that your skills are tip top. Okay. So make sure you check out the show notes to sign up for the live event. It's going to be a private Facebook group. So make sure you do that so you get on the email list and you know how to sign up for the challenge and when I go ahead and drop that live. So it'll be at 8:30 CST, so Central Standard Time. So make sure you get in on that event. There will be replays in that Facebook group. Secondly, this will also kick off my new coaching program that I have been just putting together for the last year. And it's a 6-month program where you come inside my community and I teach you all the things CT. So I have 3 tiers as far as my program. It is certification if you need time to study for the registry and get you registry ready. There's also another component where we take your skills, we elevate it. And so you can pursue higher paying position. You can pursue a traveling assignment. You can walk into any fucking hospital that wherever you live and get a job in CT, be able to sit down and scan no matter what. So we're going to boss you up. And then I have a more advanced tier where if you're interested in pursuing teaching, if you're pursuing maybe signing on to one of these vendors or management, I do have a mastermind when it comes to that. So make sure you check out the show notes. I'll have all the links for that so you can get all the details of that. So let's get into today's episode for the week. It is the July effect. Yes, I think I haven't even covered the topic of the July effect. So if you don't know what the July effect is when we have a new batch of incoming residents doing their clinical rotation. So what does this phenomenon entail when it occurs every July? And you've probably have heard patients say, do not get sick for the next 6 months starting in July. So, which tends to have some truth to it, right? So typically when we see this, we see a astronomical high volume of ordering of CTs during this time, especially in emergency rooms and ICUs and just all that shit, right? So that is typically something that you see when it comes to the July effect. All the new residents are trying to get accustomed. They're trying to figure out, they're just trying to be good doctors. No shade to them. Okay. But you make our lives a fucking hell. Okay. I will admit that. Sorry, but I'm very spicy on my podcast. And that is just the freaking truth. So a lot of times, especially when there's this high volume of ordering, what happens is we get all these pan scans and we get all these orders on a patient that they probably don't really need. And it's frustrating for the patients. It's frustrating on our department. And patients can receive unnecessary exams, overexposure because of additional exams. Nurses have to take multiple trips. because, another, service saw them. Oh, well, now they want, 5 additional CTs, which could all be eliminated if they clinically assess them appropriately from the start, right? But we all know that when it comes to crunch time and these accrediting agencies, it makes it very difficult for a physician to really clinically assess the patient. So I hate to break it to you guys, but they use all imaging to assess patients. So basically, it's get all the imaging and then we'll figure it out, which it should be the other way around. Because if we remember in the dark ages when CT was not around or no form of imaging, how did they figure out what was wrong with the patient? They had to clinically assess them. And then 9 times out of 10, take them to the OR and they would figure out what's wrong with them, right? So in today's episode, I'm going to give you 5 different things that us as technologists and as a department that we can do to help them, to collaborate with them, to be just as a team with them. Because we all know communication is very important between physicians, residents, nurses, and technologists amongst ourselves, because it's for the sake of the patient. It's not who's right, who's wrong, who fucked this up. It's for the sake of the patient. And that is the main goal. So I'm going to give you 5 ways on how we can help these residents not only utilize CT properly, but maybe just eliminate some things, right? So the most important thing is the clinical assessment. So the review of the patient's history and their prior imaging. This can really help, especially if they've had any prior CTs like within a day or two. Do we really want to re-expose them unless there's a really dire need to? But this can also be challenging because lots of patients are poor historians. They can't give you a good history. A lot of them come in unconscious, or they're nonverbal, or they just don't know. A lot of them are traumatic situations where it's a cardiac arrest, and we have no knowledge on what is going on with the patient until later on. So if patients are ambulatory, they can give you some sort of history if we've seen them before at the same hospital. And I know with EMR systems, a lot of patients' information is interchangeable where we can see it. So those are some things to kind of just eliminate unnecessary CT exams if possible, that if they've already had prior imaging and the patient saying, oh, well, sometimes, patients come in and they feel that, oh, this should be done again, and it really shouldn't, right? So the next thing that you can do is have them communicate with the radiologist. Now, what I've seen is that residents, physicians, they take the radiologists out of the mix, and then they put us as technologists in the middle. Listen, we are not the middleman, okay? We cannot decide what's clinically appropriate for the patient. That is a radiologist's job, okay? And any physician that tells you, well, what do you think? No, pass them on to the radiologist. Say, listen, this is not my scope of expertise. They have more expertise. They'll be able to guide you in the right way. And I know a lot of physicians get upset about that. Well, guess what? We have a certain amount of expertise. As far as what's right for the patient, we cannot make that call because we are not doctors. Okay. Plus, radiologists can provide them with a lot of good input on the correct imaging, if this imaging is appropriate, if it's going to be safe for the patient, if it's necessary, based on their clinical history. So if they utilize the radiologist, it cuts us out of the middleman. And we don't need to be a part of that because that's not our scope of practice. Now, the third thing is using alternate modalities. I know how much you wonderful residents hate to use other modalities because CT is your know-it-all. But a lot of things that patients come in for as far as clinical history or what they're trying to rule out can easily be ruled out with either use of ultrasound or possibly MRI or just a plain X-ray, because depending on what they're coming in for, you don't need a more advanced modality to tell you, oh, they have a broken toe. Okay. It's really not necessary to expose them with a high amount of radiation. Now, especially for pediatric patients, for appendicitis, a lot of times ultrasound is a really good, useful tool because we don't want to radiate any pediatric patients, or an MRI if it's possible. Now, MRI is possible because a lot of patients have implanted pacemakers. They have, old gunshot bullets that are not removable and they cannot have them. So if we cannot suggest, okay, that is for the radiologist to suggest an alternate imaging modality. Now, the next point that I want to drive home is to have clear protocols and guidelines. So we want our protocols to be driven so that we have these guidelines in place, because patients come in with different clinical scenarios and the residents are trying to rule out exactly what's going on with the patient. So if they have a clear guideline and protocols to say, okay, this is going to be the appropriate CT exam for this patient. This may not be appropriate. This may be appropriate if it meets this. If we have clear protocols that they can follow and guidelines, because we use all of our guidelines that are recommended by ACR and by Image Wisely, this would be a good tool to kind of direct them on the appropriate clinical tests for the patient. And my last point that I think is very, very important is some kind of decision support tool. So, like I just explained before, Image Wisely is a excellent decision support tool where it gives them a criteria for the appropriate exam based on what is going on with the patient, based on history, based on symptoms, complaints, things like that, what is going on with the patient. And what that tool does is it gives them a guide, and it provides them guidance on the best imaging practices. So it's a tool that is excellent, and it could tell you, okay, the patient comes in with X, Y, and Z, and it tells you the modality of choice that is best for that. So I think if we implement that, this will really help and kind of eliminate some of those unnecessary exams. Like, we know those unnecessary exams that come in. I can give you a good example. Patient comes in, they say, okay, what's going on? Well, I fell asleep. Like, I'm not kidding. That is an actual clinical diagnosis I had on an order. This was probably 15 years ago. The reason we were doing the CT of the head is because the patient fell asleep. Now, was it really necessary? Probably not. Was the exam negative? Yes. Was the history bogus? Very much so. Okay. But as a physician, you have to kind of filter, okay, what's real and what's not real. Now, we know when we get those drunk patients all the time, and it's just because EMS is bringing them in, because by law, if they're passed out on the street, they can't be like that. Okay. And 9 times out of 10, it's like, why are we doing the scan of his head when we know he's drunk? He needs to sober up, and that's it. So if we give them decision support tools and just guidelines, it will really, really help with that. So those are my 5 good tips that I have, or suggestions that we can do as technologists in our CT department to really help out these new residents, and just to collaborate with them and just communicate with them. Now, I know all residents are not going to be friendly. They're not going to be pleasant, and we have to execute ourselves professionally. But there is a fine line where we're talking respectfully and just being disrespectful all the way, which disrespect is not tolerated. It doesn't matter if you're a physician or not. We're all employees of the hospital, so we have to treat each other accordingly, right? So that's what we can do to help them, okay? And you're going to come across a lot of orders that are bogus. As a technologist, our responsibility is to make sure that we question all orders that are really just questionable and they don't make sense. And if they give you shit for it, say, listen, I have to do this, or I'm going to just run it by the radiologist. Okay. So I hope these 5 different tips and suggestions really help you when you encounter our new batch of residents during the July effect. Okay. Because we all know once they get trained, we get a new batch. Okay. So hope this episode was super helpful. Make sure you guys check out the show notes for the 3-day life challenge starting on July 31st. Make sure you check that out. If you're interested in joining the CT Educator coaching and mentoring program, there is a link to an application in the show notes that you can go ahead and apply, and I will get back to you in 48 to 72 hours just to make sure you're a good fit for the program. Okay. So hope you guys have an amazing week. Thank you once again for continuing to listen to this podcast. It really helps me just go ahead and share my expertise with you guys. And make sure that you like, subscribe, share it with somebody who needs it, give a review. It helps the show continue on. So thank you so much for listening, and I will go ahead and chat with you guys next week.